Is it? It does seem like longer than a minute.
We've never been out of contact with him. Yeah. Yeah. But he's good you're still here. Yeah, yeah. And Nick's a good man. He's going to do the other.
Let's stand for the invocation by Chaplain John Gerhardt.
Thank you, Dr. Chairman Malone. May we bow our heads and pray together. Lord our God, we pause as we begin this meeting of our hospital board to give thanks. We thank you for the gifts of life and health. We're grateful for the privilege we have to care for those in our community, and we ask your hand of favor upon our efforts to preserve life and to bring healing to those who come to us in need. May we do so with excellence and compassion, and may this, our hospital board, be granted wisdom as they lead the way. These things together we pray. Amen.
Amen. Let's say the Pledge of Allegiance together. I
Pledge allegiance to the flag of the United States of America, to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all.
Calling the meeting to order of the Sarasota County Public Hospital Board on May 18th, 2015. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. May we have approval of the orders of the day?
So moved.
Second.
Any comments, questions? If not, all those approving the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. Next, approval of the minutes of the meeting of April 20th, 2015.
So moved.
Second.
Any changes or comments about those minutes? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. And now we have a presentation by Dr. John Moritz, who's the medical director of the hospitalist program, on the hospitalist program. And Dr. Fiorica, you're going to introduce him.
Yes, I'm pleased to introduce Dr. Moritz. He's a local Floridian. He grew up in West Central Florida, went to high school at Largo High School. He then went on to do his medical school and residency training. He was at Nova Southeast University in Miami for medical school, and then South Broward for internship, then went to Akron City Hospital. We're happy to have him. He joined our hospital program as our hospitalist in 2006, and he's here to talk to us on how he's expanded this program and what a wonderful job they do.
Thank you. Good afternoon, members of the board, Mr. Verinder, Dr. Fiorchia. It's a honor to be here and to give you a sketch of our hospitalist program. Today we are talking about the SMH hospitalist program, which is 11 years old. If you look, there we go. A hospitalist is somewhat of a unique profession. We are actually defined by the area in which we practice as opposed to an organ system such as a cardiologist. It's the fastest growing profession in medicine right now, and we are physicians who are dedicated to the inpatient care of patients, and our job is entirely spent in the hospital. Our program in particular started off modestly with 2 members 11 years ago, and there was a mandate that was associated with this program, and that was to help manage and care for the unassigned patients that came through our emergency care center. There were a couple of points that needed to be addressed at that time. One was cost mitigation, and the other one was to standardize the care. That is, to reduce the variability in care so that all of these unassigned patients, of course, being those that haven't got a primary care doctor in the community, would benefit from the high standards that are upheld by our healthcare system. Our program today has obviously grown quite a bit. We have signed our 27th provider, and we now cover 100% of the unassigned people who come through our emergency department. There have been a lot of changes behind the scenes to help us be effective at what we do, despite or in light of this growth. And one has been we hired a dedicated clinical manager, Kristen Andrew, who has done a fantastic job in supporting us and helping us with our day-to-day operations, and helping us to affect communications both inside and outside the department, and being a team leader and a team supporter, a real advocate, and she's dearly beloved by our hospitalists. In any event, the hospice program today has been developing, it continues to develop, and is always looking at our infrastructure in how we monitor and improve our processes. We are engaged with virtually all the departments in this hospital at some point or another. But a great example of how we evaluate what we're doing and adjust processes is by our billing. We recently underwent an overhaul of how we do billing, as it were, and we have maximized revenue through sophisticated coding procedures. We do have a growth plan, and for the first time in our history, it's a rational growth plan that is actually appropriately adjusted to our capacity. This summer, we look forward to taking on 2 major internal medicine groups here in the community, so we continue onward. We have we partner with our colleagues in the community, the private care doctors, to assist them in caring for their patients. As you know, the hospital medicine and outpatient medicine continue to advance, but not necessarily in the same direction. So the skill set we bring to the table are inpatient care, and so we help them by taking care of their patients when they come into the hospital, and then returning them back to the community when they're healthy enough. And that allows them to focus their energies on the outpatient practice. Also, it should be noted we take care of 100% of the admissions that come from the Northport Emergency Department. We provide medical consultations to the patients at Bayside, and we also do subspecialty consultations to provide comprehensive medical care to those patients. Now, not going to spend a whole lot of time here other than to say that the growth is there. Since 2013, our encounters have jumped by 26%. Again, the point of this slide is just to show, whereas we started taking care of all unassigned patients, now 50% of our patients are unassigned and roughly 50% are private. So our payer mix is certainly changing. And this slide it basically shows that our commercial payers have stayed fairly constant, but Medicare has increased by an impressive 17-fold since our inception. Our admissions, if you look at the slide, it shows there's been steady growth in our admissions, but this is only part of the story. We actually touch many, many more patients than that number would suggest. We do also observation unit admissions and consultations, neither of which would be represented in that 40%. Now you might ask, well, how in the world does the system benefit from the hospitalist program? And primarily what we bring to the table is a collaborative effort to work together to improve the quality goals that we have, to review, scrutinize, tweak processes, and to improve standardization throughout the system. ultimately to improve systems, I'm sorry, processes. Some examples of that, case management, we work with to reduce length of stay, nursing staff, patient safety, and so forth. And the Emergency Care Center, we've been very helpful in helping them to improve throughput through their department. The result of all this is that we become the hospital of choice. And what that means is we want patients to think of SMH when they have the hospital needs. But we also want doctors to be comfortable here and to know that their patients are being well cared for. Moving into the future, we are a group of enthusiastic team players that are in lockstep with the SMH healthcare system and pursuing the goal of being the best hospital and healthcare system in the nation. Our interests are aligned with the hospital systems, and we are really very motivated to improve healthcare through processes, working with our colleagues in all the departments, and reducing variability in medical care. And I have to extend my most heartfelt thank you to the board members, to Mr. David Verinder, and all those in the community that have provided their support. Thank you very much.
Thank you. Are there any questions or comments? No, thank you so much. We'll move on then to the Excel winner, Norma Limehouse of Phlebotomy Tech 2 in Lab Services. It's the first recipient.
How you doing, Norma? Good to have you.
Thank you.
So I am pleased to present today Norma Limehouse, who is our Excel recipient for the month of May 2015. Norma is a phlebotomy tech 2 in our lab services department, and she's been an employee of SMH since December of 1985. Here are a few highlights from her nomination. Once again, I scrubbed these, so no worries. All right, they're from your colleagues.
Right.
Norma has made a positive impact within the community and her hospital. She demonstrates excellent customer service skills along with the confidence in her role as a phlebotomist. Norma is the patient's favorite phlebotomist. Outside of work, Norma spearheads donation drives and collects items for victims of disasters in other countries. Norma is one of the most selfless people that I know. All of Norma's nominations included these words to describe her: professional with a positive attitude, friendly and caring, reliable and hardworking, prepared and knowledgeable, above and beyond, awesome at her job, an absolute pleasure to work with, and a patient favorite. So congratulations, Norma, and thank you for everything that you do. Thank you very much.
Hey, Norma. Well, first of all, as a person who gets a blood draw on a regular basis, a difficult job, and when I see somebody who's excelled, it puts a smile on my face because I know it's going to be a positive experience. We have a plaque for you that just kind of embellishes what David put together, but it's basically an employee recognition program at Sarasota Memorial Healthcare System. The hospital board and administration staff of the Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of patient stay by making an extra effort in their daily activities. The Excel program is designed to recognize employees who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in the community. The hospital board and administrative staff are pleased to present to you, Norma, with the Excel Award for May 2015 in recognition of your demonstrated courtesy and caring attitude and contributions towards excellence at the Sarasota Memorial Healthcare System, signed by David Veringer, Chief Executive Officer, and Dr. Margaret Malone, Chair, Sarasota County Public Health Hospital Board. Congratulations very much. Well deserved.
You would.
Other than I'm very, honored to, receive this reward and to continue on to do the very best that I can for Sarasota Memorial Hospital. And that's
Thank you.
You're done, except I'm Probably have to have a lab draw soon,
Okay,
so can you be kind to me?
I will.
All right, I appreciate that.
And so next then, we have a hero award, which we don't always have each month. Dr. Garner, Heike Buchan, who's a nurse in the NICU, Heather Graber, who's clinical coordinator in the NICU, and Sue Doyle, who's an RN in the NICU.
Get you guys to come up. Come up here so they can get you in the frame here. Okay. So the Hero Award for the month of May goes to Dr. Kyle Gardner, Heike Buchan, Heather Graber, and Sue Doyle. Earlier in the year at a charity event for the March of Dimes, Dr. Gardner was receiving an award for his leadership as the department chair of OBGYN at Sarasota Memorial. While the MC of the event was reading Dr. Gardner's nomination, a member of the event staff passed out and started convulsing in the back of the room. Instead of going up to receive his award and to give an acceptance speech, I thought that was very big of you. Yeah. Dr. Gardner and the nurses hurried back to assist the patient who was in trouble. With Dr. Gardner at the helm and the help of our awesome SMH ICU nurses that were attending the event, they stabilized the employee until EMS arrived. The event continued and Dr. Gardner accepted his award. Always with a sense of humor, he reminded the group that he is an OB doc, so he usually asks the patient to push instead of to breathe. Thanks to all involved for our heroes and representing SMH so well. Thank you very much. Yes.
If you don't mind, I'm going to basically cover the award and then we'll provide each of you. I've given a lot of speeches, but that's a heck of a good way of getting out of giving an acceptance speech, but thank God you were there. It's the important part of this award. We're giving each of you are hereby inducted into Sarasota Memorial Healthcare System Team SMH Hall of Fame as a hero on this 6th of May 2015 for meritorious customer service, including consistently exceeding the expectations of our patients, families, visitors, and staff, being an example to peers and others, having a personal commitment to excellence, and going above and beyond for individuals in our community. Signed today by David Berenger, President and CEO, and Dr. Margaret Malone, Chair of the Sarasota County Public Health Hospital Board. And I've got Dr. Gardner's here. Congratulations.
We're gonna
baby trans.
Congratulations to all of you.
That's actually why. Sorry. But,
Come on.
Well, thank you very much for the wonderful award. Our patients are usually much, much smaller than that, but we were glad to help, and it's a great pleasure to be in this Hero Award. Thank you.
And so for a report of the medical staff, Dr. Jim Fiorica, Chief of Staff.
Yes, I have one action item for the board. It is recommendations that Dr. Patrick Fitzgerald be the medical director of the bariatric service. The recommendation was approved by the Medical Executive Committee on April 27, 2015.
I move approval of the medical director agreement for bariatric medicine as recommended by the Medical Executive Committee.
We have a motion and a second. Any discussion? Hearing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
That concludes my report.
Thank you, Dr. Fiorica. So the auxiliary report, Dottie Ziegler, Auxiliary President. Oh, my God. Why are we doing this?
Thank you, Madam Chair. I would like to talk to you today about the scholarship presentations. That was our big event in May. And on Tuesday, May 5th, the auxiliary held the scholarship award reception. We were delighted to give out 6 Duncan Finley scholarships this year and 2 Karen Sharp scholarships. The Duncan Finley scholarships are offered to any graduating senior in Sarasota County who is majoring in a healthcare career. The criteria for these scholarships are based on financial need. The family income cannot be more than $50,000 per year, and usually many that we get are much lower than that. The cumulative GPA of the student has to be a 3.0, and they must be interviewed by a committee. This year we had 18 applicants for 4 available scholarships. After reviewing the applications and interviewing the students, there were 6 deserving students. The board decided to give 2 additional scholarships this year for a total of 6. The scholarships totaled $10,000 per student over a 4-year period. They sign a contract to keep up the same criteria throughout the 4 years to continue to get the funding. We want to thank Karen Diffley and the Education Department for their help in keeping the records, transcripts, etc. of the students throughout the 4 years for these scholarships. The students who received the scholarships were we had a reception in the Papaya Room, and this is just an overview of the families and the recipients. In addition to the families and the recipients, we had a couple of the board members that came, and thank you for coming and joining us. The auxiliary board members, we had some of those, and some people from the education staff, but there was quite a number, about 40 of us there. And this is a picture of the folks that got the Duncan Finley Scholarship Awards. Hannah Dale, Erin Monroe, and Marina Walter, who are all nursing majors. And Marina just happens to be one of our own teenage volunteers, so it was really special to be able to give one to her. Ni Wen and Nicole Adler are physician assistant majors, and Alexandria Bartley is a pharmacy major. We also presented the Karen Sharp Scholarship Awards. These are given to seniors from our own ranks of teenage volunteers. They are a one-time award of $2,000. These teens are nominated by the chairman of the service they work on. This year, the committee had 2 teens that were equally deserving of this award, and again, the board decided to go ahead and give both awards, so we gave 2 of the Karen Sharp Awards. The recipients were Annalise Hardman and Natalie Olson. This first picture is a picture of Annalise Hardman and her family. And this is Natalie Olson and her family. You'll notice both of them have parents that are working here with us at Sarasota Memorial. And these are the 2 winners of the scholarship from Karen Sharp. It's great to be a part of being able to help students like these become educated professionals of the future. In my closing remarks on Tuesday evening, I did encourage them to consider coming back to SMH in the future for internships or career opportunities, because in the 4 years it'll take them to graduate, who knows what we'll have here, because we're growing. Thank you, Madam. That concludes my report.
Thank you. So Sarasota Memorial Healthcare Foundation, Alex Quarles, President.
Thank you very much, Madam Chair. Just a very quick and brief report. I'll just say thank you to everybody that participated in our 14th annual golf tournament. We netted around $90,000. Our EPIC campaign, the goal was $75,000. I think we're probably going to exceed some of that. Key to the Cure is already scheduled for October 15th through the 18th. And during that time, those of you that remember Pat Snyder, who started the Kids Under the Weather program, their sons will have a golf tournament on October 17th. We've done about a little over $300,000 in major gifts, and we have about a $5.2 million pending grant that we are working on, actually with my partner next to me. From a media point of view, I want to thank Peter Taylor and his team and our new Director of Marketing, Nikki Taylor. We have now had 638 sessions online with 612 conversions, meaning people that have actually converted to Sarasota Memorial Healthcare Foundation and making contributions or getting involved. In terms of public relations pickups, since February through April, we've had 34 press releases accepted, and we are rolling out a new website, which should launch in September. Our investments are strong. We're still holding at about $40 million in net assets, and we've given over $60 million in grants. The most recent grants this last month were about $770,000 for the replacement of the handheld devices, communication devices, as well as $200,000 for the two TrueDs, or what I like to call them R2D2s, and so on and so forth. But we'll have about a little over $1.5 million in grants by the end of the year. We have one more grant round ending July 31st. We did select our officers for next year and new trustees that will be coming on board. The executive committee will remain the same. Art Wood will still be the chair. Richard Clark will still be the immediate past chair. Vice chair is Jim Seipert, treasurer Lou Levy, secretary Bill Chapman, and myself for executive. And the new and/or returning members of our board will be Phil Delaney from Northern Trust, Richard Garrity from Sabadell Bank, Margaret Wise, Deborah Kabanoff, and Charles Shivery. And that concludes my report. Thank you
very much. So we'll move on to the secretary's report. Mr. Tom Towler.
Thank you, Madam Chair. I have the June board meeting schedule in front of me. On Tuesday, the 2nd of June, at 8 o'clock is the board breakfast. At 9 o'clock, the Quality Committee. 10 o'clock, Mission and Planning. And 11 o'clock, the HR Committee. And 12 o'clock, the Governance Committee. On Monday, the 15th of June, at 11 o'clock, we have a review of finances. At 11:30, a peer review. And at 1 o'clock, the public board meeting. That is my report, Madam Chair.
Thank you very much. So the treasurer's report, Mr. Joe DiVirgilio.
Thank you. Just one item today, which is approval of the bad debt and charity care, and in that regard, I propose the following motion. I move approval of the bad debts and charity care for the month ending April 30th, 2015, in the amount of $15,204,000.
Second.
Are there any comments or discussion? If not, we have a motion. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
That's all I have.
Thank you. And the first operations report, Mr. Bill Wojin, Chief Financial Officer.
Good afternoon. I have the financial highlights for April 2015, which both month and year-to-date numbers. Starting with the system's operating revenue for the month of April, $57,104,000 compared to a budget of $51,059,000. Through 7 months of our fiscal year, $372,398,000 compared to a budget of $342,031,000. For the system's operating expenses, or total expenses, for the month of April, $51,836,000 compared to a budget of $48,411,000. Through 7 months of the fiscal year, $351,878,000 compared to a budget of $337,721,000. The system's operating income in the rating agency format for the month of April, $7,888,000 compared to a budget of $5,053,000. The operating margin for April was 13% compared to a budget of 9.8%. For our fiscal year to date, operating income of $39,396,000, or an operating margin of 9.9%, compared to a budget of $23,267,000, operating margin of 6.3% in the budget. For hospital fiscal year-to-date statistics, the average daily occupancy, 456, compared to a budget of 395. The admissions, 16,372, compared to a budget of 15,867. Our average length of stay through 7 months is 5.02, and 1 year ago at this point, it was 4.58. The hospital surgery cases through 7 months total 11,718, compared to a budget of 11,206. So far, through 7 months, we've had 1,868 births, compared to a budget of 1,692. The hospital's outpatient registrations, again fiscal year to date, 252,230, compared to a budget of 251,272. Emergency care registrations total 68,831, compared to a budget of 61,601. And for our case mix index fiscal year to date, for all patients 1.73, and for Medicare patients 1.92. Madam Chair, that concludes my report unless there's any questions.
Thank you very much. And Lori Lang, our Chief Operating Officer.
Thank you, Bill. Madam Chairman, members of the board, it's my pleasure to present the operating budget for the month of April. Trauma. On May 1st, Florida's Department of Health granted Sarasota Memorial Hospital the provisional level 2 trauma center designation. And we had projected, whoops, let me move forward. God bless you. We had projected 1 to 2 patients per day, and we, for the first 2 weeks, have exceeded that by about 20%. So since May 1st, we have seen 44 patients. 22 were called in the field by the EMS system, and they were made up of 6 motor vehicle accidents, 3 motorcycle accidents, 2 gunshot wounds, 8 falls, 1 burn, 1 bicycle accident, and 1 pedestrian who was struck by a car. 4 were brought in by a helicopter, and 50% of our patients that were designated as traumas were discharged from the emergency department. And this is a picture of our brand new trauma bay, and we have 2 of them. And I went down and toured this last week, and it really is truly beautiful. Oops. Moving on to construction, Bayside West is at one of our psychiatric facilities and was struggling with air conditioning, and it was costing us more to repair it than to replace it. So we have replaced the air conditioning units, and the good news, it is now up to Miami-Dade hurricane code requirements. So if air conditioning is not exciting, we'll move on to garages. And I went really far. Okay, I am. Forgive me. Okay, these are teasers for later. We're going to the garage.
North Garage.
As promised. The garage, whoops.
Oh.
We will get better with this skill, I promise. The garage, we were having some drainage issues in the garage, which was causing some concern about our structural support. So we have put in new drainage, which you see on the right, and some additional steel support on the left. So all is good with North Garage. Oh, golly, this is too quick. I need help. Okay, we'll go on to oncology program. Just go up one, please. Okay. Our Oncology Day treatment is currently located on 4 South and 4 Redder, and they will be moving to a newly constructed facility on 5 Southeast. For those that you may remember, this is where we housed our Kids Under the Weather program. The move date is scheduled for the week of June 22nd, and with the move comes a new name, and this facility and unit will now be called Sarasota Memorial Infusion. Thank you. Comprehensive Rehab Facility, this is our timeline. May 13th, the City of Sarasota approved our site plan. We are planning on vacating the Redder building in mid-June, and that's when the abatement process will begin. That will be the taking down of asbestos and some of our hazardous materials in that facility. And then in mid-June, we'll begin the interior demolition, and then in September, we'll begin the structural demolition. Our emergency care center reception and waiting. Our current waiting area is insufficient to meet the needs of our patients and their family. We have 22 chairs at this point, but luckily we have some unusable space that we can make usable, and we will be adding a capacity of 33 chairs to come up to 50 in the 1,750 square feet, which is in the rectangular section kind of in the middle of that schematic. The architect and contractor will have a kickoff meeting on May 21st, and the design is expected to be completed by June 2015, and we're expected to start construction in August. OR expansion. With growth, we need some additional OR space. So on the left red box is our current area where we're going to be expanding to create 2 new ORs. The challenge was, do we take 2 up at one time, but it takes longer? Do we take them 1 at a time? So we've decided to go 1 at a time because that way we can have one hopefully available within the year. So they will be new, greater, and larger. One will be 832 square feet, and the other will be 773 square feet. Currently, most of ours are averaging about 400 square feet. Waldemere. So when we built the new tower, apparently we had some redundancy with numbering of rooms. We had about 7 rooms that had the same room number. So we are changing our numbering system, and it will be with 1 letter and 4 digits. The letter represents the elevator closest to that unit. The first number will be the floor, and the last 3 will be the room number. So we are doing this over a several-week period. It will be done by the 25th of June. And while some people may think it's just changing the number on the wall or the doorway, it really has significant impacts to all of our systems. So just to mention a few, the systems that need to be upgraded or adjusted for this new numbering are pharmacy, radiology, lab, respiratory, pathology, food and nutrition, registration, scheduling, transcription, and of course, billing. So all that will be underway and completed by the end of June. St. Armand's. Most of you know we've had tremendous support by Lido, St. Armand's, and Longboat Key. The City of Sarasota Board of Adjustments will be meeting on May 27th to hear a request for about 5 variances. Design and development drawings are complete. And once we get that approval, we anticipate demolition to begin in June, and we are anticipating this facility to be up and running by December of 2015. Moving to the smallest members of our Sarasota Memorial family is our child care center. We have 2. We care for about 293 little ones at any given time. 78% of those are members of employees of SMH. And our programs include camps, before and after school programs, coverage for holidays, spring breaks, etc. And of course, for kids that are too young to go to school, we have daycare throughout the day. Recently, there was a law that changed that says if any children are being transported, they must be secured in National Transportation Safety Board compliant restraints. So our 20-year-old bus did not have those constraints and restraints, so we are the proud owners of a brand-new van that can transport 15 children safely with seatbelts. And that is my report, Madam Chair. Are there any questions?
Thank you very much.
Thank you. Thank you, Bill.
There are no board reports today, so we'll go on to committee reports. For the Finance Committee, Mr. Richard Merritt, Chairman.
Thank you, Madam Chairman. The Finance Committee met on May 5th. The ICD-10 preparations update was given by Diane Settle, who stated that implementation is fast approaching. I believe it's October the 1st. The team has been very dedicated for over the 4 years that it's taken to start to implement this. Diane stated that the team has done a very good job of moving through all the steps necessary. The new coding is very specific for laterality and alphanumeric. And there is an increase in codes by 9-fold over the ICD-9, so you can see why the staff's done a very good job, and it has been delayed a couple of times, so hopefully we'll go live soon. Diane reviewed the hospital system's organizational readiness and the work with IT, which has been an enterprise-wide impact. ICD-10 will affect 59 different systems, of which 46 are completed, 7 are in process, and 4 more with the go live. So it's quite a task, and we're hopefully that it all goes through well, which I'm sure it will. Increasing patient safety through visual camera monitoring. This is one of our look-backs at something that was approved and went into effect in January 2014. Janet Stevens discussed the visual system. The goal is to increase patient safety and decrease cost. The program is designed to visually monitor patient safety, reduce safety attendant costs, and increase floor efficiency. She discussed the attendant hours and costs, various labor costs, and total budgeted capital. There have been 2,200 interventions for patient safety since inception, and since inception, the program has saved $920,000. Nelson Lane reported on the insurance renewal. The renewed property premium coverage is $2.1 million. Limits have increased from $50 million to $60 million on windstorm coverage, and for all other perils, it is $600 million. The property rate is just under 17 cents per $100 of coverage, and is the same as last year, even though coverage has increased. So Nelson and team, very good job. Bill Wojin introduced Donna Scott and Joanne Sable from Cape Surgery. The Cape Surgery Center, and provided some background. Cape opened in 1985. Providing leading-edge services to the community. In June, they will celebrate the 30th anniversary. Last year, Cape did over 3,400 cases, of which GYN, ophthalmology, ENT, and plastic are the main categories. Cases are 9% above budget for 2015. Press Ganey likelihood of recommending is at the 75th percentile, with 3 consecutive months of scores in the 99th percentile. Recent facility improvements made at Cape were discussed, including the 2013 renovation of pre-op area and post-op area and new flooring in the receiving area. And that is my report.
Thank you very much. Yes. Absolutely.
I just want the community to know that thanks to Mr. Bill Harrison and Williams Parker and Mr. Cape, they made that facility possible through a donation, that the Helen S. Cape Surgery Center is available thanks to the community and through his work.
Thank you. So we'll move on to the Quality Committee. Mr. Bob Strasser, Chairman.
Thank you, Madam Chair. I'd like to make a motion. I move approval of the Emergency Operations Plan for 2015 as recommended by the Quality Committee.
We have a motion and a second. Any comments or questions? Hearing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. So we'll move to the President's report. Mr. David Verinder, President and CEO.
Thank you, Madam Chair. So I'm going to start today with our leader report card that we look at each and every month. And we'll start today under service pillar, and we track our HCAHPS, which is our inpatient patient satisfaction score. We have a goal of being 9 out of our 11 indicators at a 50th percentile or better. And I'm happy to report that we are year-to-date at 9 out of 11. So appreciate all the work from the teams that go into that. On the outpatient side, we have a goal of being at an 83rd percentile for likelihood of recommending our outpatient services. And I'm happy to report that we are exceeding that, and we're hitting 84th percentile right now. When we look at our people pillar, we have merits on time. We have a goal of being compliant 95% of the time. A little bit low on that. We're at 91%, but we have been making up ground each month, and plan on getting there by end of the year and getting to our goal. Our turnover rate goal is to be at 16% or less. Happy to report that we are, for the second month in a row, now we're at 13%. So we are tracking well in that pillar as well. In the quality pillar, we have an organization percent of patient safety readiness. We have a goal of being at the 95% standard. Happy to report that we are exceeding that at 98%. Infection prevention, which is our combined overall standardized infection rate, we have a goal of being under 0.95, which a national average would be a 1.0. And I'm happy to report we're at 0.93, so a good bit under the national indicator. In the finance pillar, we have a goal, or a budget of 4.4%, and as Bill Wojcik, our CFO, reported, we are on track to hit 6.7% for the year, so exceeding that. In the growth pillar, our inpatient admissions are at a goal of 26,308. We are exceeding that. We're at currently 26,807. Despite quite a bit of change from inpatient to our observation patients, we're still seeing some growth in that, or beating our goal in that. In our outpatient registrations, our goal is 755,000. We are exceeding that. We're at 676,574. Going to the next page, we're looking at our detail on our HCAP scores. And so fiscal year to date, we are at 9 out of 11 as I reported. So we have two items that are a little bit below. One is responsiveness of hospital staff, and the other is quietness of hospital environment. We are still putting a lot of resources behind both those questions, and hope to see some more improvement soon. When we look at our outpatient scores, we have our goal of 83rd percentile, and as I reported, we're at the 84th. But here's a breakdown of how our departments come in. And you see on the far right, the departments that are at the 85th percentile or better. In the middle, those above the 50th, and a couple, four departments that are below the 50th, but some of those pretty close. And our goal is to continue to move departments from the left to the right hand of this chart. And I think we're making good progress. Moving into service, I'm proud to announce that we had done some surveys with our physicians and looking for our highest scoring physicians in their specialty. And so we have listed there, not sure how many, but it's about a dozen physicians, each in their own specialty, who had the highest service scores. Scores were calculated from the patient response communication with doctors on the HCAHPS survey. And those questions are: during the hospital stay, how often did doctors treat you with courtesy and respect? During the hospital stay, how often did doctors listen carefully to you? And during the hospital stay, how often did a doctor explain things in a way you could understand? And I would just like to congratulate the physicians that are listed in front of you as having those highest scores in their respective specialties. We did present them with a plaque and thanked them personally. Dr. Fiorica, I see your name on there.
Yes.
And so I signed yours myself. How about that? Thank you very much. Continuing in people, last month we celebrated our National Volunteer Week, honoring the selfless community members who donate their time and expertise to SMH. I just wanted to thank you all, a big thank you to all of our wonderful volunteers for things you do each and every day. Please relay that, Dottie. Staying in people, a team from our Northport ER and our healthcare center participated in a Northport American Cancer Society Relay for Life. Our Northport team raised over $1,800 for the American Cancer Society, so just wanted to thank everyone who participated in that. Staying in people, last weekend we had a SMH bike team that participated in Bike MS, the Citrus Tour, which as it turns out is a 150-mile ride from Fantasy Flight in Polk City to the Carib Royal Hotel and Convention Center in Orlando and back. This premier cycling event raises money for National Multiple Sclerosis Society, with the majority of funds going directly to improve lives of people living with MS. And so we very much appreciate all those people and their hard work, plus those who support them.
Those are good-looking shirts.
You like that?
Yeah.
Well, I can't go backwards on this, but I'd bring it back up, Tram, if I could. Are you a biker?
No, no.
Okay.
I noticed the logo.
Well, they'll sign you up. Okay. They try to recruit people. I've avoided them. Going into staying in people, I am thrilled to let you know that we all celebrated our 2015 Nurses Week last week from May 6th to the 13th. You know, honestly, we can't do enough to thank the people who work in our nursing and take care of our patients every day. I think they all appreciate everything that we do for them, but we appreciate them more. So you see some pictures here from Nursing Week. Probably the most disturbing would be in the bottom center by our pastor Gerhardt, who I see left the room, and Superman, who joined him, which was quite entertaining. Continuing in people, our March of Dimes walk and our NICU reunion was held on May 2nd at the J.D. Hamill Park. I just wanted to thank all those who volunteered and walked, and I know everybody had a great time and great participation there. Into quality and safety, it really is what is a great sense of pride that Sarasota Memorial Healthcare System is now certified as a comprehensive stroke center through DNV. Really sets us apart. SMH is the first hospital in Florida to receive the DNV comprehensive stroke certification. We earned certification after an intensive 2-day survey last month. The survey team was very impressed and mentioned that our presentation was the best they'd seen. So thanks to David Patterson and his team for helping us get there. Continuing in quality and safety.